Jane Collins tries to lead a healthy life. She eats a nutritious, low fat, low carb, high fiber diet and maintains a healthy weight. Jane does cardio and weight resistance exercise on a consistent basis. Although at times her demanding work schedule prevents her from doing as much physical activity as she would like and also prevents her from getting enough sleep. Most nights, Jane only gets 4 to 6 hours of sleep. Jane has a stressful job and frequently suffers from migraines, which she and her physician attribute to stress. The table talk topic I would like to address with Jane are healthy strategies to reduce stress, which will hopefully help alleviate her migraines. Hi, Jane.
Hi.
My name is Anne Marie Langfeld, and I'm a nurse at Christ Hospital. It's my understanding that you've been experiencing migraine headaches.
Yes, I have. I've been getting migraines for years, but over the past few months, they've gotten much worse. I'm a marketing executive, so I'm constantly up against deadlines. Over the last few months, we've been continuously overworked and understaffed. Therefore, there's been a lot of tension in my office. I think my migraines have gotten worse because of that stress, and when I spoke to my physician about it, she agreed and thought so too.
I would like to talk to you about some healthy strategies to reduce stress and help alleviate your migraine headaches. Research shows that a stressful event or a particularly stressful day often occurs 2 to 3 days before the onset of a migraine headache. Keeping a migraine diary can be helpful in identifying personal triggers and helping to identify patterns in migraine headaches. Avoiding personal triggers once they're identified should help reduce your number of migraines in the future. Jane, could you explain in your own words why it might be beneficial to keep a migraine diary?
A migraine diary might help me see the patterns in my migraines and determine what causes them so I can avoid those things. Then hopefully I won't get as many migraines in the future.
That's correct, Jane. As we move on, I'd like to talk to you about information you should be tracking in your migraine diary. This information should include details such as when a migraine begins, where the pain is located, how long the migraine lasts, and whether treatment works, what you have eaten prior to onset, what exercise you have engaged in within 2 to 3 days of onset, what social or work activities you have participated in within 2 to 3 days of onset, menstrual cycle details, how you are feeling in general, and what is your level of stress within 2 to 3 days of onset. And something that is very important to note is how much sleep you've gotten in the 2 to 3 days prior to the onset of a migraine headache. You will have this list to refer back to as you write in your migraine diary.
Thank you. I think keeping a migraine diary should give me some very valuable insight about my triggers. Now that you've mentioned it, I think a lack of sleep could definitely be a big factor. I frequently burn the candle at both ends when I have a deadline. It's not unusual for me to only get 4 to 6 hours of sleep during the night during the week.
Lack of sleep is known to trigger migraines in some people. 7 to 9 hours of sleep is what is recommended for adults. Another healthy strategy to combat your migraine headaches is to aim for getting at least 7 hours of sleep each night.
That might be tough with my job, but I have been so miserable with these migraines that I'm definitely willing to make getting enough sleep a priority. I consider myself a health nut and really try to live a healthy lifestyle. I eat a high fiber, low fat, low carb diet and do cardio and weightlifting on a regular basis.
That's great, Jane. Healthy strategies to alleviate migraine headaches include eating a healthy diet, exercising regularly, and maintaining a healthy weight. It's beneficial that you're already doing those things and important that you continue to do them in the future. You should aim to exercise for at least 30 minutes a day, but I would also encourage you to add yoga to your exercise regimen. Yoga is a mind-body practice that combines physical poses, controlled breathing, and meditation or relaxation. Yoga has been proven to help reduce stress, lower blood pressure, and lower heart rate.
My sister Carol does yoga for stress relief and swears by it. She's been trying to get me to go for years.
It sounds like your sister could be a great source of support. Turning to family and friends for support is another healthy strategy for relieving stress. I realize we've discussed a lot of information about reducing stress in order to alleviate your migraine headaches. As we recap, could you list the healthy strategies that you could employ to reduce your stress and alleviate your migraines?
Yes, I'm going to keep a migraine diary so that I can figure out my migraine triggers and in order to avoid them in the future. I'm going to try to get at least 7 hours of sleep each night. I'm going to make sure that I'm exercising at least 30 minutes a day. I'm going to integrate yoga with my sister and also continue eating a healthy diet and maintaining a healthy weight.
I think that's a great plan, Jane. These healthy strategies should help reduce your level of stress, but are also fundamental aspects of the healthy lifestyle you are seeking. I hope this plan succeeds in alleviating your stress and also eliminating your migraines. In this table talk, I used Chunk and Check with Teach Back as my educational method.